Welcome to The Explainer. Today we're diving into one of the absolute most incredible, heavy-duty structures in the entire human body, your stomach. Seriously, think of it like a powerful, well-defended fortress. Its walls are built to withstand incredibly harsh conditions every single day, just keeping you nourished and keeping you safe.
But here's the ultimate biological paradox, right? How on earth does your stomach survive its own acid without digesting itself? I mean, it's literally filled with acid strong enough to dissolve metal, yet the stomach remains entirely intact. Well, until the defense system fails, that is. When those fortress walls are breached, we get a condition that affects millions of people worldwide.
Okay, so here's our roadmap for today. We're going to cover the stomach's protective shield, what exactly gastritis is, the culprits causing the breach, symptoms and red flags, uncovering the damage through diagnosis, and finally, treatment, healing, and prevention. Section 1. The stomach's protective shield.
So before we look at the breach, we really need to see this fortress at full strength. You've got this highly specialized team of cells lining your stomach wall. There are parietal cells pumping out harsh hydrochloric acid and chief cells producing digestive enzymes like pepsinogen. But the absolute unsung heroes of your anatomy? Those are the mucus cells. They are constantly creating a thick, protective mucus shield. Without them, that parietal cell acid would literally eat right through your stomach tissue. No joke.
Let's see how this actually plays out in action. Food enters, and bam, the acid and digestive enzymes immediately get to work breaking it down. But while this violent chemical digestion is happening, that mucus acts as a critical physical and chemical barrier. It keeps the stomach wall perfectly safe before the partially digested food moves on to the duodenum. That is your normal, healthy physiology working exactly as it should.
Section 2. What exactly is gastritis?
Well, our story takes a bit of a turn here. Basically, gastritis is the inflammation of the stomach lining, the gastric mucosa. When that brilliant mucus barrier gets compromised, the acid reaches the really vulnerable tissue underneath. The body's alarm bells ring, inflammatory cells rush right into the stomach wall, and you end up with painful swelling, redness, and tissue injury. Now, this breach doesn't always happen exactly the same way. On one hand, you've got acute gastritis. That's a sudden ambush, developing rapidly, and often triggered by things like a severe illness, a binge of alcohol, or NSAID pain relievers. On the other hand, chronic gastritis is more like a slow, stealthy siege. It develops gradually over months or even years, often driven by persistent infections or autoimmune conditions where your own body turns on itself.
Beyond just how fast it happens, we also have to measure the physical severity of the damage. Non-erosive gastritis means the walls are highly inflamed, sure, but they're still intact. But erosive gastritis? That is a deep structural failure of the wall. The damage eats right into the lining, creating painful erosions or even full-blown ulcers that bleed.
Section 3. Culprits, causes, and risks. So if the fortress is breached, who or what is actually responsible? Enter the ultimate stealthy invader, Helicobacter pylori, or just H. pylori. This fascinating, corkscrew-shaped bacteria actually burrows into the stomach lining just to escape the acid. It sets up camp, chronically infecting and degrading that protective mucus over time. It's a massive risk factor not just for gastritis, but for peptic ulcers and even gastric cancer.
But H. pylori doesn't work alone, you know? Heavy alcohol use and smoking are direct chemical irritants. Severe physical stress from major surgery, burns, or trauma can absolutely trigger acute attacks. There's even autoimmune gastritis, where the immune system mistakenly attacks its own acid-producing parietal cells. But I really want to draw your attention to NSAID medications, things like ibuprofen, naproxen, and diclofenac. Overusing these actually reduces chemicals in your stomach called prostaglandins, and those are exactly what your stomach needs to keep that mucus shield thick and strong.
Section 4. Symptoms and red flags.
Once the damage reaches a critical threshold, the internal alarms start ringing, and they ring loudly. These are the daily discomforts that patients face. And hey, if you've ever felt this, your pain is absolutely valid. A damaged mucosal barrier means acid is burning raw tissue. You get that burning upper abdominal pain, nausea, bloating, and that incredibly frustrating feeling of being completely full after just a few bites of food. It's a constant, agonizing disruption to normal life and digestion.
Now, listen closely because this is crucial. If you ever experience vomiting blood, black tarry stools, sudden and severe abdominal pain, fainting, or a rapid heartbeat, these are absolute medical emergencies. These red flags indicate that the inflammation has caused dangerous gastrointestinal bleeding or that your body is going into shock. This requires immediate, urgent medical evaluation, no questions asked.
And if we just ignore the problem, well, the timeline becomes pretty sobering. Left untreated, chronic inflammation over months can literally lead to gastric atrophy over years, where the stomach lining just wastes away. Decades down the line, this can progress to intestinal metaplasia, where the cells mutate, significantly increasing the risk of stomach cancer. This is exactly why early intervention is completely non-negotiable.
Section 5. Diagnosis. Uncovering the damage.
Luckily, doctors have a fantastic investigation toolkit at their disposal to figure this out. It starts with your medical history and blood tests to check for things like anemia or a B12 deficiency. Then specific tests like urea breath tests or stool antigen tests to hunt for that tricky H. pylori bacteria. But the absolute gold standard is the upper GI endoscopy. This lets the doctor physically look inside the stomach with a camera, visually uncover the inflammation and bleeding, and even take a tiny biopsy of the fortress wall for microscopic clues.
Now, there's a lot of common medical confusion around stomach pain, so let's just clear that up right now. Gastritis is a broad, general inflammation specifically located in the stomach lining. GERD, on the other hand, is when acid actually travels upwards into the esophagus, causing heartburn. And peptic ulcer disease involves deep, localized sores, rather than the generalized, widespread inflammation we see with gastritis.
Section 6. Treatment, healing, and prevention.
Okay, the really great news here is that we know exactly how to rebuild these fortress walls. Medical management is highly effective when we follow the evidence. Doctors often use proton pump inhibitors, or PPIs, which powerfully block acid production, essentially turning off the acid tap to give the tissue a chance to heal. But if H. pylori is the culprit, eradication is the absolute cornerstone of preventing a recurrence. That means taking a targeted combination of antibiotics and acid suppressors to completely clear that bacterial invader from your body.
Alongside medication, your daily nutrition acts as a completely vital shield. While trigger foods do vary widely from person to person, sticking to soft, non-irritating foods, lean proteins, and whole grains prevents further agitation of that sensitive, healing lining. Conversely, limiting heavily spiced foods, large fatty meals, and alcohol stops you from pouring gasoline on the inflammatory fire while your body's just trying its best to rebuild.
To truly maintain these defenses long-term, specific lifestyle adjustments are absolutely key. Using NSAIDs safely under a doctor's guidance, stopping smoking, and practicing good food hygiene to avoid bacterial infections, those are massive steps. And surprisingly, even physiotherapy plays a role. By promoting proper posture and gentle activity, it helps manage the severe physical stress that can compromise your digestive health to begin with.
As we wrap up today's explainer, I want you to remember this. Gastritis is incredibly common, but it is entirely manageable. Early diagnosis and proper treatment actively prevent life-altering complications down the road. Your stomach is a miraculous, self-defending fortress, but even the strongest walls need maintenance. So the next time you reach for a quick antacid to just numb the pain, you've got to ask yourself, are you just putting out a tiny surface fire, or is it finally time to repair the integrity of your entire fortress? Thanks for joining us, and keep protecting your health.